大家好，我係City Smart Irene。咁我今日咧好高興咧嚟到QUT Kelvin Cove Campus Health Faculty of Health 呢度。今日亦都好高興咧，隔離咧大家可以見到咧 Mrs. Sue Walker。咁佢咧就會同大家介紹一下咧，就關於嗰個 Bachelor of Health Information Management 呢個 course 嘅。Good morning, Sue. How are you?
Hi, Irene.
Nice to meet you. Yeah, nice to meet you. I know that like Hong Kong students, they are interested in the Bachelor of Health Information Management course at QUT. And I would like to ask, what are the distinctive features of this program? Can you explain a little bit to our potential students and parents?
I can. So our degree has 3 distinct areas that students study. One of them is information technology. So we teach students how to use IT to support a business, a healthcare organisation. We don't teach them to be programmers. We also teach them about medicine. So we teach medical terminology and pathology and those sorts of things. And we teach them about management, so project management and management of staff.
Oh, okay. Then are there any placement embedded in the program?
Absolutely. We have placements in 2nd year and 3rd year. So the 2nd year placement is just a very short placement where the students go out and work in a hospital for about 5 days, and they do some practical application of some of the units that they have studied. But then in 3rd year, their final semester is spent completely out in the workplace doing the equivalent of an internship, if you like, 4 days a week.
Oh, okay. But does QUT like organize the placement for the students? And are there any placement guarantee for the students if they like need to sit any selection interviews or something like that?
Sure.
Yeah.
So QUT does support the placements taking place. So we actually offer students a list of all the hospitals and health organisations that have offered to take students, and students have a choice. Okay. And we try as far as we can to match the student with where they'd like to go. We can't always do that. Yeah. And then there is no selection requirement. Students do have to have some vaccinations, and there are some requirements that they've got to complete if they go into a Queensland health hospital, in terms of things like understanding confidentiality. But every student gets to do a placement, and QUT certainly supports that.
What do students normally do during the placements?
So if I think about the final year placement, for example, there are 3 things that they do. One of them is work shadowing a practicing health information manager. So they're basically following that person around and doing what they do. The other thing they do is a project. So hospitals nominate a project that they would find valuable, and students do that project. And then the 3rd thing is what we call clinical classification or coding. So that's all about reading hospital medical records and assigning codes to diagnoses and operations.
I see. One very important question, which I think most of the students and parents would like to know. Do most students successfully complete the program, and any academic support services available to students?
Absolutely. Nearly 100% of our students complete the program, and we're a relatively small degree, so we know our students very well and we can monitor how their progress is going. But QUT also offers international student services, we have counselling, the library offers academic support, we have language and learning support, so there's all sorts of support that students can take up if they need it.
Oh, that's very good, because you know, it's very important for international students especially. Yes. And then I would like to ask is, what is the professional recognition of the program?
So our degree is recognised by the Health Information Management Association of Australia. So students who complete our degree are eligible for full graduate membership.
Oh, that's very good. So is there any, do they need to sit for any professional exam or any other type of test or something like that?
No, they don't.
Okay.
Because we are accredited by our professional association, that means that we meet all the core competencies that graduates must be able to perform. So that means that once the student has graduated, then they are eligible.
Okay. Okay. And how about the employment? Any idea on the employment rates of our graduates of this program?
I love this question. So our degree has been going for 8 years and we have a nearly 100% employment rate across all years of the program. And many students either get a job before they finish their degree or as a result of that final semester placement.
What will graduates normally do and where are they employed?
So most of our graduates will go out and work in a hospital as their first place of employment, either public hospital or private hospital. But we also have some graduates who work in statistical agencies, in the Ministry of Health, who work in research, basically anywhere there's health information and somebody needs to manage it and report on it, there's a job for a health information manager.
Oh, that's very good. I think now Sue has already given some basic information to potential students and parents. If you would like to get more information, you can contact us. We have office in Australia and in Hong Kong. And then with Hong Kong DSE students, I would like to mention about the academic requirement and the English requirement as well, so that you will know whether you will be possible to meet the entry requirement. With the academic requirement, Hong Kong DSE students, you need 16 points or above. We take the best 5 subjects of the DSE. And then it's across the core and category A or C electives, where 2 is the minimum accepted grade. With the English requirement, QUT will consider the level 4 overall in English subject, which if you get this mark, you will meet the entry requirement in the English part. And the DSE results need to be completed within 2 years if you within 2 years of starting at QUT. So if you need more information, or if the information you need is not covered within today, please contact us. Thank you, Sue. Thank you so much.
Thank you for the opportunity.
Okay. Thank you. Bye.